Hi, everyone. We are here for office hours. Erica should be joining in just a minute. Today, we are talking about stool testing, all the things, all the details, what the experience is like, who needs one, um, why we order them, what we can learn from them, all sorts of really cool things here. So, we're really excited about that. Erica should be here in just a minute. And let's see here. See her here. Here we go. Hey, Erica.
Hi, how's
I'm
it going?
super excited. I don't know why the camera looks so close to my face today. Let me see. I feel like I don't know what's going on.
It does.
Hi, everybody. Maybe if I move, let's be back or something. Um, yeah. So let's get started. I don't know why my face is taking a whole camera, but it is. But anyways, let's get started talking about stool testing. It's a really, really helpful tool that we use in our practice. And I feel like a lot of times it really helps us get to the root cause of someone's health issues, especially when there's digestive problems that have been going on for a long time and no one can seem to figure out what's happening. A lot of times we'll pull this in as a tool to help us get some answers for people.
Right. Everything really stems from the gut. I know we've talked about this before. We do look at a lot of other things like that very holistic picture, but we get the most accurate and fast results when we can really take a look at what's going on in the gut. I always explain it's kind of like your unique fingerprint. Your gut tells that story too, and everybody's is very unique. So those custom tests really help us get to the bottom of what dysfunction is going on in the body.
Yeah. And one thing I will say, I want to make sure that anyone who's ordering a stool test gets to see this video as preparation for their testing. One thing that we're trying to do, and we've talked about this in team meetings so many times, but when it comes to the collection and it comes to stool testing, people are like, you mean I like really I have to collect my poop? And I'm like, I mean, let's just like talk about it, right? Like, what is it really like and what should they expect? Because there's one thing I want to make sure that all of our clients are getting for the stool testing in terms of equipment. Um, but yeah, like just to be really clear, like, yes, you're collecting your poop and yes, you're collecting it for 3 days. And the other part that's really funny and kind of disgusting for people is that you have to put the samples that you've collected in the refrigerator after you've collected them. So whenever a client is signing up for this process with us, it's new. I mean, like not a whole lot of people have done it or are comfortable with it or whatever, but it's really helpful. We get a lot of good information out of the test, which we'll talk about in a little bit. But one thing I really like to make sure that all of our clients have is the proper collection supplies. So because we care about you guys so much, we actually upgrade the collection supplies with our lab company to make sure that you guys are getting a tub to collect in. There's actually like a it's like a frame, I guess, that goes underneath the toilet seat. And I talk with my hands so much. This like only being a head on here is really kind of freaking out. I don't know why I look so big. Um, there's a tub that, or a frame that goes under the toilet seat, and then there's a tub that sits in the frame. It's a white plastic frame and a white plastic tub. So if you had ordered a test from us and you do not have these things, we need to know because we're working with our lab. They should automatically be sending this to everyone. But if you've done the stool test recently and haven't gotten these, or you're doing the stool test now and watching this video and don't have these, make sure that you let your dietitian know, because the other alternative to collecting the stool is I call it the French fry container. It looks like if you've ever gone to a baseball game and ordered French fries, it's like the red and white checkered like cardboard thing, and you're literally supposed to catch your poop in that. And I don't want that for our clients. It's like hard enough collecting stool, but it's even worse if you have to like try to catch it as it's coming out into this cardboard box thing. It's not even, I don't know if I call it a cardboard box. It's a French fry container. So make sure you have the right supplies. We've worked really hard on our end to get that right with Genova and have them automatically send it to all of our clients. But if they don't, we want to know about it. It makes the collection process much less stressful, I think.
I think that's one tiny piece of everything we have put into thought as far as the stool testing goes. So there are a lot of different stool tests out there, and we're very comfortable with a lot of the different ones. We have experience with them. So if they came in with old results, we definitely would know how to handle it. But I think we've gone really in depth in all of these different companies to choose the best one. So Jenny, do you want to talk about some of the reasons we've chosen the GIFX?
Yeah, so we use GI Effects by Genova, and I have used this almost my entire career. We look around a lot. We really do, to make sure we're using the best. But what I love about GI Effects and also Nutribel from Genova, you can look at the test results and see the patient's story without you could look at the test results and guess what was going on with the patient if you didn't already know.
Mm-hmm.
And you could look at the patient and they would be telling you the symptoms that are having, and they match with the test results every single time. And it's not that we could guess in terms of what the test results would be, because it's much more complicated and in depth than that. But like, because the test results always match the clinical picture, it really makes me feel good about using them. They make sense every single time. Other testing companies that we've tried or gone with, not so much. So I really never question the test results when it comes to the GI effects that we're using. A couple of other things I just want to brag on about what we're doing here in the test. So we're using a 3-day stool collection. I'm sorry you have to collect your stool for 3 days, but it is the best way to get a really thorough picture of what's going on inside of the GI tract. We also have the collection done during the full moon, because that's when it's easiest to catch parasites. So yeah, every month we're watching that time frame for you. If you're working with us, you should know when the full moon's coming, so we probably told you. But that's another key. Instead of just like a random one-off sample any time of the month, this is a really targeted, intentional 3-day collection during a time of the month where you're more likely to catch parasites, which is one of the things that we look for. And I will say, with any stool test, parasites are really hard to find. And just because you don't find them doesn't mean that they're there. But we also have some other clues that we look for that can help to identify parasites, even in the absence of finding them actually on the stool test, which is pretty helpful.
One of the things I really like with the GIFX is the way they look at it in multiple ways to see if it's actually showing that picture. So unfortunately, it takes 2 to 3 weeks to get the test results back, but it's because they're looking at it under microscope. They're doing DNA testing, and they're also culturing to see how much is growing, how vibrant it is, so that we're truly getting that full picture. It's a pretty phenomenal test.
Yeah, and what's really cool is with the GIFX test, Genova is looking at inhibitory agents. So if you have an overgrowth of bacteria, they're going to test your specific bacteria that came from you that's overgrown against different agents to help fight it off. So antifungals, antiparasitics, antibacterials, whatever. But they're looking at specifically, like, not just how any strain of like streptococcus, for example, would respond to berberine, but like how your specific streptococcus that you have is responding to it. And to me, that is like the ultimate. It is so specific to that person and what they're dealing with. I just think it's really awesome.
You know, each person is very unique as far as what we find. But I mean, you would agree with me too, I'm sure, that by having this custom data on somebody, we're able to just specifically target. We know the exact probiotic we should be recommending. We know if we need to work on gut healing, like if the lining integrity is an issue. We can see those specific strains, but then also look as a whole in the digestive tract. you know, how well is it functioning? So, and there's a hierarchy. So if we see parasites or um, there's candida, for example, we know we need to focus on those things first because like we talked about last week with the SIBO testing, many things can present the same.
Yeah.
So we can give recommendations based on symptoms, but that might take a lot longer. This is really a fast track way to get to the root of the issue and heal on a much faster way. So, yeah, I really, part of it though is for accuracy is prepping for the test.
Yeah.
Do you want to talk about that a
Um,
little bit?
I'm going to give that one to you, but like, I think
Oh,
this is
okay.
a really huge point. Go ahead.
Yeah, so we try because all of these tests we do are very specific, and that's part of what comes with our testing when you work with us is we make sure that you're doing the right things beforehand so that we get the accurate results. So for example, if you're on a PPI medication, you will always show up negative for H. pylori. So we will never be able to truly we won't be able to tell if you actually have it. So there are things ahead of time that we're having you stop. Steroids, antibiotics, NSAIDs, enzymes, binders, antacids, lots of things can affect the results of the stool test. So beforehand, we will make sure that at the right time frames, you're stopping those things so that we get the most accurate results. You know, I think another thing to point out is we have people that will bring in their test results, which is great because we talked about that unique fingerprint, but the gut changes over time. So we get people asking questions too, like how often do I need to test? Um, so we look at that. Yes, you can. We'll look at it from like a historical standpoint. We like to see results and trending over time, but the gut really can change within 1 to 3 months. So we would love to have you on a protocol. We'd love to retest to see where things are at. So if people come in with test results a year old, we can give them guidance of like for historical reasons. But yeah, I don't know. What do you think about that? If they come in with test results from a year ago.
I think that probably too much has changed, and we don't know that we're still looking at that. So I think it's really in their best interest to get another test. Um, yeah, and the other thing too for the prep for the test, this isn't our like in our specific testing instructions, but I think diet like kind of just like keeping to your regular diet and not
Mhm.
doing anything super extreme before and just being mindful. And we've even talked
Yeah.
about this. I think it's a really good idea. Having people keep a food journal around when they're testing too can be really helpful for test prep and just making sure that we're looking at what we think we're looking at.
One of the markers on there is pancreatic enzymes, but then there's a further breakdown of how much protein we see and different types of fats we see in the stool. So it really can depend on if you ate those foods or not. So if you were on a very low protein diet for whatever reason, that could skew the results. So it is important also, yeah, like you said, to that we look at what the diet was prior to the testing.
Yeah, or even like seeing more fat in the stool, but maybe you had just a randomly higher fat day, like day before. It's just helpful for us to know that.
So I think a lot of people they get the idea of what a test result, you know, we're collecting stool, we're looking at different strains of bacteria, we're looking at that unique profile, but what do we do with those recommendations? How long does it take to heal the gut? I think that would be really helpful for people to know too.
Yeah, and I think this is a good time to kind of just summarize like all of the things that you get when you do a stool test. So we're looking at like markers for digestive health. So for example, like the implication would be like, do you have enough stomach acid? Is your pancreas producing enough enzymes? We're looking at your short chain fatty acids. And we're also looking at if you have specific strains of probiotics, right? So acromancy is really hot right now. We can tell you if you have that or if you need more of it, which is pretty awesome. Um, we're also looking at the potential for overgrowth of pathogens, like we've said, yeast, bacteria, parasites, for example. So all of that stuff, do you have enough digestive support, and do you have an overgrowth of anything that you shouldn't have? And do you have enough commensal bacteria? You would not believe how many people we see with no good bacteria in their gut coming back on these stool tests. And that just, it really blows my mind. And yeah, the other really great question is, well, okay, like I've done this stool test, I've submitted my results, this is what they say, like, what do I do? So what's really nice about having the test results is we're not guessing. We can give you really targeted ways to increase your gut bacteria or to get rid of your specific strain of candida. Or we might find I did a stool test back in 2014 probably, when I was trying. So this is funny, Erica, and everyone who listens to last week's. I thought I had SIBO, and I at the time had no idea what I was doing. And my doctor ordered a stool test to test for SIBO, which like it doesn't do. But what I did find when I did this stool test, and everyone at our practice has done a stool test. So we've all been there in the trenches with you guys. I don't recommend, the only test I haven't done in our practice that we recommend is the SIBO test, because I know I don't have SIBO and I don't want to be ingesting SIBO stuff that can kick off the kind of highlighting the bacteria that I don't have. Like I just, when it comes to ingesting things I don't need, I don't do it. But back to my SIBO stool test story. So stool tests don't test for SIBO, but they can flag for SIBO. So it's really nice to do a stool test in conjunction with the SIBO test, because then we really have all of the information. If you do a stool test without a SIBO test, we might say, hey, this is really looking like a SIBO case, but we need an official SIBO test. So I think that's kind of interesting. But whatever it is that we find in your stool test, we have targeted protocols that can help to rebalance and rebuild your digestive system. So it can be really, really helpful. Just instead of guessing about what's going on, we have evidence that we can really work with and help you to feel better really quickly.
Yeah, and it can be things. So yes, there are definitely going to be supplements that will help speed up that whole process of either rebalancing, killing off certain things, healing the gut lining. But there are really significant diet changes too. Like it just could be small little tweaks, but really impactful things that can help change that as well. We also take into effect, I don't think you said this, but the motility. It really matters, gut transit, how fast or slow things are moving through the system. So all of that is taken into account, even lifestyle things, sleep, exercise, those things change the gut bacteria. And we have more gut bacteria than cells in our body. And it's that symbiotic relationship. They're producing neurotransmitters, they're producing hormones, they're feeding other gut bacteria. So it's a very, very intricate system. And when one piece is off, it can throw everything off. So that's why, like, even we talk about the acidity level or how many pancreatic enzymes, because it's that starting point. If you aren't properly breaking down foods in that second step, first step is chewing, but second step, you're going to have issues all the way down the line, and it paints that picture. So yeah, it's not one piece of it. It's literally probably 50 different things that we're looking at to make it a whole story.
Yeah.
So I think one thing people ask is like, how long does it take to heal the gut?
Yeah, and this is like so interesting. Erica and I were in a call this morning with another lab company looking at some of their advanced testing. They do a lot of work with the immune system and helping people get like really specific broken down information on their immune systems. And you can really support better the more you know about your system. But one of the tests that they have looks at it can actually tell you how long it should take to heal your gut by looking at different markers. And for some people, the timeline based on what they're looking at can be a year. And for some people, it can be 6 months. I feel like a lot of our clients see a pretty significant turnaround within 3 months,
Mm-hmm.
if not sooner. But you've got to keep on it. The more and the longer, of course, the damage has been going on, or that you've had health issues or digestive issues, the longer it's going to take to feel better.
Mm-hmm. And then don't forget the piece of maintenance. That's also really huge. Life does happen, could be environmental stuff, or unfortunately having to go on a round of antibiotics. There are things long term, based on what we know about each person's, I don't know, maybe weaknesses in the gut. There are things we would do long term so they never get so out of balance again and have those sort of symptoms.
Yeah. Yeah. And I guess we've got about 10 minutes left in here. So if anyone watching, I know we've got a few viewers, has questions, please type them in and hopefully we'll see them in the chat box. Can you see them, Erica?
I can never tell how to see the live chat either. It's not like showing in here.
I can see a feed of people watching, but I can't see. I think you're on mute. Did you know that? You just mute. There you go.
Oh, yeah, I can't. I don't know how to tell either. Sorry.
All
On a
right.
phone,
Well,
it's
hopefully
different.
I think we'll pop on this feed. But yeah, let's see. What else do we want to talk about? How long does it take to heal? We have the best tests and yeah, the importance of prep. What else?
I think that was
Make sure
most of
you
it.
have the right equipment.
Yeah.
Um, let's see. Is there anything? Here's one. Is there anything you should not do before a stool test? Well, before ours might be a little bit different because all labs are different. But anything you should not do before the Genova stool test?
I think we covered most of this, but like you said, don't significantly change things up right beforehand. So eat the way you were eating. Um, I guess I've had a couple people that have said, "Oh, I was really sick. I just had COVID. I just like it, we had talked before, I've just been on antibiotics." That can really significantly change the gut bacteria. Each day we eat, our gut bacteria changes. So it is a constantly evolving thing. So I know it's not ideal, but you have to find the most common or like typical way that you've been eating, how you've been feeling, all of that. The other piece, if you the looser your stool is, the harder it's going to be to get a good sample. So try to make sure it's like a pretty typical stool for yourself and not like very liquidy. Do you have any recommendations based on that either? I think that can be hard for people because some of our patients go back and forth from diarrhea to constipation. Any recommendations there?
Um, well, it makes me think more of the constipation side of things. We've had people like trying to collect during the full moon, which we, try to do like it's a 3-day collection, so maybe the day before, the day of, and the day after. But we have a lot of people that cannot have a bowel movement every day. So the rule of thumb for that is that Genova can make the test work as long as you can get 3 days of collection within a 10-day window. And they have to be refrigerated too. That's the other piece, but you do have technically 10 days to do your 3-day collection. So that can be helpful.
I think Genova's been great to work with as well. So if like the like SIBO, for example, is not done correctly or they can't get the stool test within the 10 days, they'll send you a retest. Not that you want to have to redo it, but it's really important to us to have that accuracy. So it's definitely something that we make sure all the way throughout.
Yeah, I agree. They've been really awesome to work with. And there was one, I think this is like one of those tests. Like there's some tests that I think everyone should do every single year. And this is not one of those for me. I say if you are not having any sort of digestive problems, do not order a stool test as a marker of your health and wellness. I feel like at any given time, you could find something in someone's GI tract that could raise a flag, and that could send you into a tailspin. So like Nutraval, I think is
Mhm.
great to do every year, even if you just to make sure you don't have nutrient deficiencies. Glucose monitoring, I think everyone should wear a glucose monitor for at least a month out of every year, just to check in and see what your metabolism's doing. And there's other tests. I think monitoring stress is great. A food journal is great. Like there's lots of things I think we offer that are helpful for people to do just to check in for health and wellness. But stool testing isn't one because like I said, I just feel like you could find something. I mean, we have all sorts of bacteria living in our gut, but if you're asymptomatic and you're not having a problem, your body is probably handling it just fine. So that's not something that I think you'd want to go looking at as like a way to optimize health and wellness or to enhance like your longevity or things like that. Same with SIBO testing. Like if you don't have digestive problems, don't mess with these tests. Don't do you agree?
Yeah. I'm maybe as far as the stool test, I don't know. I still think there's something to learn from the gut and your type of bacteria because the thing is, you don't always have symptoms. And we've seen this with certain patients. They have the worst possible symptoms, but the test doesn't show exactly that, or the people that have very little symptoms and their gut test is horrible. So I don't know. I am a pretty big believer in everything stems from the gut, and I think people would benefit from it. But I agree with you, like Nutraval would probably be a number one because it takes a huge look at like potential, all different potential areas. And some of the markers even on that can indicate if there's potential gut issues. So I see what you're saying though. Like, for example, we all have done the stool test. I don't really have like symptoms or anything, but the blastocystis did show up on mine, but I have absolutely no symptoms related to it. And there's conflicting information out there on do you need to treat it? Could it actually be beneficial? So, yeah, I know what you mean about not going down a tailspin of now what do I need to do about this? And it's about the big picture still. And that's why we look at what is the diet like? What was your health history to paint a more accurate picture, not just. So I think that's a good point of like looking at that stool test. We don't just base our recommendations off the test alone. It's on people's symptoms, it's on their health history, lifestyle, absolutely everything. That's that holistic look. So.
Yeah, we look at the labs and then we look at the people and then we look at the labs again and try to, fit all the pieces together, make sure that what we're recommending makes sense and that it's also a good fit for the person because sometimes we'll even find ourselves in a situation where there's an intervention or a test that we would really love to run, but we know just our clients so well that it might not be a good fit for them too. So that's always kind of an interesting
Mhm.
situation. Um,
One other, so we've had people come into us saying, I've had every test done at the doctor and nothing is wrong. So there are some differences in the stool test we do than the stool testing that's done at a doctor's office. So the level, it's ours are, the PCR, the DNA level. Usually at a doctor's office, they'll do some of the big things like C. diff or E. coli or Giardia or certain parasites. But again, it's not to the sensitivity level, and they usually will miss or can't find things on those tests. Do you have anything
yeah.
to add to that?
Um, no, and well, also kind of like I said before, though, it's probably like a one-off collection, not
Mhm.
really specified time frame. No one's asking anything about what you ate,
Mhm.
um, in the days of or before. Yeah, so I think we probably have a lot more markers and we're a lot more intentional about how we're running the test.
Right, and reading it.
Yeah,
That's an art too.
yeah, we spend a lot of time reviewing the test results and also working up supplement recommendations and dietary protocols too. So there's a lot that goes into our testing. Yeah, I think that's a pretty good summary of stool testing. And just to be really clear in terms of who needs it, I would say anyone experiencing digestive distress. It could be gas, bloating. Some people even come to us with burping that cannot stop. Um, Definitely diarrhea, constipation. If you think you've tried everything, I promise you, Genova, the 3 day stool collection on it, there's just nothing else like it. It is so incredibly helpful and insightful. Anything else, Erica, in terms of who this test
Yeah,
is
I
for?
would say anybody with an autoimmune
Oh,
condition.
yeah, that's a good one. I like that.
Yeah. I also find, I don't know if you have, but people with fluctuating weight, like significantly fluctuating, 3 to 5 pounds, and they'll just vary day to day. That's often, like inflammatory response,
Yeah,
food sensitivity, but it comes down to leaky gut and gut issues. So that would be another really good one.
yeah, I agree. So hopefully this helps if you've ordered a stool test, if you're thinking about ordering a stool test, if you're having some digestive distress, hopefully this gives you some guidance into what stool testing can do and how it can make a difference for you. We see it really being a game changer for a lot of people. So I'm glad we got to spend some time talking about it today.
Yep, I agree.
All right, cool. Well,
Thanks.
thanks so much, everyone, for joining. Thank you, Erica, for your time today. And we will be back next Monday.
Sounds good.
All right, bye.
Bye.